Hello everyone, we are from SGD B2, majoring in Graduate Studies and Professional Doctors, Medical Faculty of Udayana University. Today we would like to present our student project entitled Acute Myeloblastic Leukemia. Before we get started, we would like to express our gratitude for the guidance along with our student project making process provided by Dr. Endang Sri Widianti, MBiomed SPV Consultant as our facilitator, and Dr. Lawson Adnyani, SPPD KHOM as our evaluator. These are our group members. The table of contents of our presentation today are introduction, includes background, problem formulation, objectives and benefits. Contents includes general description, epidemiology, etiology and risk factor, clinical manifestation, pathophysiology, diagnosis, management, prognosis and complication. And the last one is summary, includes conclusion and feedback.
Greetings everyone, my name is Adiva Buana Putra Pratama, and I'm here to tell you about the background of our student project. The first one, acute myeloblastic leukemia or AML is the most common leukemia in the adult population, accounting for about 80% of all cases. AML is characterized by clonal proliferation of immature blood cells in peripheral blood and bone marrow, leading to ineffective erythropoiesis and bone marrow failure. The incidence of age adjustment for people aged 65 and over is about 20.1 per 100,000 men per year. The next one is our problem formulation. The first one is, what is acute myeloblastic leukemia? How is the epidemiology of acute myeloblastic leukemia? What is the etiology and risk factors of AML? What are the clinical symptoms of AML? How to diagnose a patient with AML? How to manage acute myeloblastic leukemia, and the last one is, how is the prognosis of AML? The next one is our objectives. The first one is knowing the general description of AML, knowing the epidemiology of AML, knowing the etiology and risk factors of AML, knowing the clinical symptoms of AML, knowing the diagnosis of AML, knowing the medication of AML, and the last one is knowing the prognosis of AML. This one is the benefits of our student project. The benefits of the student project are as follows. The first one is the theoretical benefit. This is aimed to invigorate knowledge and cognition surrounding acute myeloblastic leukemia. The student project is expected to increase the understanding about AML and serve a literature for further research and reading references related to the disease. The second one is the practical benefit. The student project is expected to increase the knowledge of healthcare professionals about acute myeloblastic leukemia so they can apply it in daily life or work decently.
My name is Iswari with the last 3-digit student number is 118. Today I would like to explain about the general description of acute myeloblastic leukemia or AML. Acute myeloblastic leukemia or acute myeloid leukemia is an abnormality of differentiation and proliferation of myeloblasts as the myeloid progenitor cells. The abnormality found in bone marrow and peripheral blood causes bone marrow failure and erythropoiesis problems. General symptoms of AML are anemia, headache, bone pain, easy bruising, excessive bleeding, and recurrent infection. People with AML may also experience fatigue, feeling weak, and shortness of breath. AML risk may increase as people are getting older, but kids and adolescents are also affected. Cure rates of AML is rising about 40% for patient younger than 60 and 15% for patient older than 60. But it should be noted that elderly people still suffer from AML and the prognosis is still poor. This type of cancer should be treated as soon as possible as the progress of the disease develops so fast and the abnormalities of these cells can spread to other organs such as the brain, gums, and skin. People at high risk of getting AML are older age, people with smoking habits, people who had chemotherapy in the past, exposure to radiation, and people with certain inherited disorder of blood cells. Based on WHO classification of AML, there are several types of AML according to the underlying causes. For diagnosing AML, history taking and clinical examination should be done properly with the support of laboratory examination. This choice of examination is based on the available technology and the examination with the most accurate result to confirm the diagnosis of AML. The prognosis of AML is mostly influenced by the patient condition and severity of the disease.
Greetings, I'm Dhiyo and my student ID number is 200251133. The epidemiology of acute myeloid leukemia. Acute leukemia accounts for 1.2% of all newly diagnosed cancer cases. It accounts for 67% of leukemic death and a third of all leukemic cases. The incidence rate is 4.3 per 100,000. That is higher in old age and found higher in male versus female by 1.2 to 1.6 times. Mortality rate for this disease is 2.8 per 100,000, which increases with age, especially if diagnosed at above 65 years old. The prevalence rate of this disease is 13.7 per 100,000, although this still needs more research.
My name is Vivias Kiala with student ID 169, and I'm going to explain about etiology and risk factors of AML. AML is usually caused by DNA mutation in bone marrow, which is stimulated to produce way more white blood cell than normal. These white blood cells haven't fully developed, so they don't function well. Typically, mutation involves many genes, sometimes even chromosomes. These changes can be caused by translocation like RUNX1, MLL, and TET2 mutation, deletion in TP53 mutation, inversion, and addition or duplication of chromosome. The most common mutation is nucleophosphate-1 mutation, which stimulates myeloid proliferation. DNA MT3A mutation is an example of missense mutation that causes abnormality in hematopoiesis and methylation. Other mutation known as CEBPA mutation and c-KIT mutation. Certain people may have inherited DNA mutation from a parent, but that is not the case in most patients with AML. Although what triggers genetic mutation has yet to be known, it is believed that there are a few things that can increase the risk of developing AML, which include radiation, chemical substance exposure, history of chemotherapy medication, blood disorder, and also genetic condition. That's all from me. Thank you.
Hello, my name is Karina with student number 20025111003, and I will be explaining about the clinical manifestations of AML. Many signs and symptoms of AML are the result of the shortage of normal blood cells, which happens when the leukemia cells crowd out the normal blood-making cells in the bone marrow. These shortages shows up on blood tests, and they can also cause symptoms such as fatigue, weakness, headaches, pale skin, and shortness of breath. Cancer cells or blasts are bigger than normal white blood cells that can clog the smaller blood vessels, eventually causing leukostasis. When the blast affects blood vessels in lungs, it can also cause shortness of breathing. Some types of AML can also cause bleeding problems. If leukemia cells spread to the skin, they can cause lumps or spots that may look like common rashes. Leukemia cells may build up in the liver and spleen, making them larger and causing hepatomegaly, splenomegaly, or even hepatosplenomegaly. Although any of the symptoms and signs mentioned before may be caused by AML, they can also be caused by other conditions. That is all from me. Thank you.
Okay, hello everyone. I will introduce myself first. My name is Joko Tresina Dede Pemayon with the last 3-digit number of 165, and today I will explain to you about the pathophysiology. So AML is characterized by mutations in hematopoiesis-related genes, and these mutations cause undifferentiated myeloid precursors or blasts to clonally expand in the peripheral blood and bone marrow, and resulting in inefficient erythropoiesis and bone marrow failure. And in the majority of cases, AML develops from scratch in a previously healthy person, while myeloproliferative diseases or MPD or MDS and paroxysmal nocturnal hemoglobinuria and aplastic anemia are among conditions that can lead to AML. In AML, the underlying pathophysiology is a maturational arrest of bone marrow cells in their early stages of development. The exact mechanism of this halt is unknown. However, it frequently involves chromosomal translocations and other genetic and or epigenetic anomalies that cause gene activation or inactivation.
Hello everyone, my name is Putu with the last 3-digit number 103, and now I'm about to continue the explanation about the pathophysiology of acute myeloid leukemia. As AML is a heterogeneous disease, it can be caused by different cellular and molecular abnormalities, which, depending on their types of mutations and abnormalities, may lead to variable prognosis. According to the prognostic types, there are 3 types of AML, which include favorable, intermediate, and adverse AML. With favorable AML, have a good prognosis and can be easily treatable. And then there's intermediate between the two, and at first AML, which is hard to treat because it's usually resistant to treatment and can be very deadly to patients. So on the table on the right, you can see what kind of abnormalities that can affect the prognosis. For example, for favorable prognosis, it can be caused by translocations of 8 and 21 chromosomes and several other mutations, while the adverse can be caused by translocations of the 6 and 9 chromosome and several other mutations, which can be seen in this table.
Is Gusti Frangipani Vedanti with the 3 last digit of my student identification number is 064. Today I'd like to tell you about the diagnosis of acute myeloblastic leukemia. Diagnosis of acute myeloblastic leukemia involves anamnesis, physical examination, and supported by adequate laboratory results. For the anamnesis, doctors usually pay attention on patient symptoms, other health problems, and possible risk factors for leukemia. For physical examination, there are many organs that are being concerned by the doctor. For example, eyes, mouth, skin, lymph nodes, liver, spleen, and central nervous system. Doctors will usually search for areas of bleeding or bruising and also symptoms that possibly indicate an infection. For laboratory results, it is performed to confirm the presumed diagnosis, and it is helpful for the initial diagnosis and also the follow-up of acute myeloblastic leukemia. The first laboratory test is bone marrow aspirate. It is one of the most important diagnosis tests in acute myeloblastic leukemia. The diagnosis can be made if more than equal 20% of myeloid blasts are found in the bone marrow or certain specific cytogenetic abnormalities are detected. This test required two steps. The first one is morphological assessment, and the second one is blood count enumeration. For the morphological assessment, it will assess the morphology, the relative progression of non-blast cell types, and also evaluating dysplasia. Next one is cytochemistry. It helps us to assign lineage and subtype EML in the prior FEB classification. The third one is immunophenotyping. It helps us to confirm the diagnosis of EML if there is minimal differentiation. The first one is flow cytometry. It helps us to assess the percentage of bone marrow involvement. And the second one is immunohistochemistry. It helps us to assess the cell blast count if bone marrow aspirate is inadequate. The next one is cytogenetics. These test results will show if there is any chromosome abnormality. On the other hand, chromosome abnormality are found approximately on 50% of adults with EML. The next one is molecular studies. Most EML cases present with more than a single mutation. And the last one is real-time RT-PCR. It is very useful, especially in subtypes with abnormal fusion protein.
Hello everyone, my name is Khasandra and Damara with my last 3 name digit is 152, and I'll be explaining about the management of acute myeloid leukemia, or as we know, AML. So the gold standard of AML therapy remains a combination of cytarabine-based and anthracycline-based regimens. For candidates with eligible conditions, allogeneic stem cell transplantation should be considered. Induction therapy as the first phase therapy aims to eliminate as many leukemia cells as possible in the shortest time. It consists of the 7+3 regimen that consists of continuous injection of cytarabine for 7 days, accompanied by administration of anthracycline on the first 3 days. After achieving complete remission with induction therapy, consolidation therapy is given trying to destroy any remaining leukemia cells and help to prevent a relapse. It is done with a high dose of cytarabine called HIDEC and hematopoietic cell transplantation, or as we know, HCT. That's all from me. The next part will be explained by my friend, and thank you.
Hello everyone, my name is Dewa Bintang Prantasari with student number of 2002511211. So today I would like to explain about the prognosis of patient with acute myeloid leukemia. So the first thing that will affect the prognosis is the age. Elderly patient will lead into poor prognosis because poor prognosis is usually associated with the increasing age of the patient. The second one is the white blood cell count. High white blood cell count will also lead into poor prognosis because it has been associated with clinical sign of greater tumor burden. The third one is performance status. Poor performance status usually reflects comorbidities and organ dysfunction. This has proven that performance that is poor status will also lead into poor prognosis. Therapy-related AML will also lead into poor prognosis because according to the studies, patient with TAML has considerably worse outcome. Next, we have prior hematological disease. In AML patient, a prior diagnosis of myelodysplastic syndrome or myeloproliferative syndrome is recognized as a poor prognosis risk. Next, we have chromosomal abnormalities. Chromosomal abnormalities are classified into two, favorable abnormalities and unfavorable abnormalities. Favorable abnormalities in AML are the translocation between the chromosome 8 with the chromosome 21. And we also have a translocation between chromosome 9 until chromosome 22. And at last, we have the abnormalities of the chromosome 11 at the spot of Q23. And lastly, we have genetic mutation. Certain genetic abnormalities, which is the FLT3 or KIT mutation, are more related with high white blood cell count, which might be the poor prognosis of the patient with acute myeloid leukemia. So that's all from me. Thank you.
Hello, my name is Komang University Jaya with my last 3-digit number 037. I would like to continue the presentations regarding complications. Chemotherapy targets rapidly dividing cells in the body, including cancer cells as well as normal and healthy cells. Chemotherapy side effects might vary based on the medication employed. The production of normal blood cells is reduced in AML. Destruction of healthy cells in bone marrow by chemotherapy cause significant deficit in patient red blood cells, leading to anemia, defect platelet leading to thrombocytopenia, neutrophils leading to neutropenia. Lack of neutrophils and monocytes during AML therapies can lead to infection from bacteria and fungi found in the environment, including skin, nose, mouth, and colon. Chemotherapy may raise the risk of infections because it affects the lining of mouth and the intestines, make it easier for germs to enter the bloodstreams and cause infections. Chemotherapy has an effect on tissues with a high rate of cell turnover. As a result, the skin, hair follicles, and mouth and gut lining may be compromised. Other negative effects including ulcers, diarrhea, hair loss, rashes, vomiting, nausea, and fatigue. Thank you.
Hello everyone, my name is Yosephina Gracela Taji with last 3-digit student ID number 087. And I will explain about the summary. Acute myeloblastic leukemia or AML is an abnormality of differentiation and proliferation of myeloblasts as the myeloid progenitor cells. AML is rare but often fatal, and myeloid malignancy prevalence appears to be rising. Patients with AML show a variety of symptoms, including recurrent infections, anemia, easy bruising, excessive bleeding, headaches, and bone pains. Bruises, pallor, hepatomegaly, and splenomegaly can be revealed in physical examination. Sometimes a skin rash due to infiltration of leukemic cells will occur. Infections can occur because of leukopenia and neutropenia. Leukostasis is rare, but also can occur in patients with AML. For the diagnosis of AML, anamnesis and physical examination should be done, and also supported by adequate laboratory test results. The gold standards of AML therapy remains a combination of cytarabine-based and anthracycline-based regimens. Induction therapy is suitable for patients with certain characteristics. Chemotherapy has shown to improve the survival rate among the elderly. The prognosis of acute myeloblastic leukemia, or AML, is based on the prognosis factors itself. Some complications came from chemotherapy medications that target rapidly dividing cells in the body, including cancer cells, as well as normal healthy cells. Chemotherapy side effects might vary based on the medication employed. And the last one is the feedback. Acute myeloblastic leukemia, or AML, is the most common leukemia that can affect various parts of the human body. Despite genetic conditions having a higher risk in developing AML, avoiding other risk factors is very important. Good controls by practitioners in the chemotherapy can help to prevent some complications in treatment for patients with AML. Okay, so that's all and thank you.